Hey, psychonauts and people interested in psilocybin therapy. So, I want to walk folks through what the bill that's moving through the Minnesota legislature, HF2906 in the House and SF3917 in the Senate, that is proposing to create a psilocybin therapy pilot program um, to treat mental health conditions. So, the way that the program would work is that people that are interested in partaking in the program and receiving psilocybin treatment would make an appointment with a physician, a doctor who could diagnose whether you have one of the qualifying conditions that are showing promise in clinical trials with psilocybin. So, this would include, but is not limited to, depression, post traumatic stress disorder, substance use disorders, anxiety, pain, and we're keeping it fairly broad in terms of not saying that it can only be those conditions because clinical trials are happening all the time with psilocybin for more and more health conditions that seem to generally show promise for a lot of different things. So someone would go and get a diagnosis. They would get confirmed by a physician that they have the qualifying condition and that they also don't have any other health conditions or medications that they're on that might not react well to a psilocybin session. And then at that point, they'll be recommended to the program and then they can register to the program. It'll likely be regulated by the Office of Cannabis Management. And then people will basically get a medical card that will be active for 1 year. During that first year, folks need to find a facilitator. So there'll be some specifically trained psilocybin facilitators that will be licensed by the state to be able to be these kind of therapists or psilocybin facilitators for the program. And for the initial pilot program, this will be limited to folks that already have a mental health license to treat people with mental health conditions. And so those people will receive additional training to be psilocybin facilitators. They'll get licensed by the state and then they can kind of find each other, the clients and the facilitators, to come up with a treatment plan. And then once that's developed, go and pick up the supply from one of the state regulated supply centers that will grow the mushrooms, test them, dose them, and put them into a form that folks can take in a treatment setting. And the idea is to do this for a 3-year period, collect a bunch of data, see if it's worth continuing or expanding or modifying, or if it's too risky or too expensive, shutting it down. So it's not a long-term commitment, but it's a way to get people access, collect some good information about it, and hopefully create the framework to make this more of a reality here in Minnesota.